Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Thursday, September 30th, 2021, and this is our COVID briefing. Today we're reporting 128 new COVID cases in Missoula County. We currently have 42 Missoula County residents and 16 out-of-county residents hospitalized for COVID in Missoula County, and we've now had 129 deaths due to COVID. Our incidence per 100,000 people is currently at 89. Today, I'm going to talk about hospitalizations, the recent increase in deaths from COVID-19, booster doses of COVID vaccine, testing, what we know so far about vaccine becoming available for younger children, and flu vaccine. So first, let's talk about the hospitals. Today, hospitalizations in Missoula again broke the record with 58 hospitalizations. The hospitals continue to ask residents to be responsible and get vaccinated to alleviate pressure on their system. The vast majority of those that are hospitalized are unvaccinated. The hospitals are getting National Guard support to help with the situation. However, the National Guard is largely helping clean rooms and other tasks that don't directly involve patient care, so they're still having some staffing concerns. We've recently seen an uptick in the number of people who are dying from COVID-19. From Tuesday the 21st to Tuesday the 28th, we had 11 residents pass away from the virus. About half of those were in middle-aged residents and the other half in older adults. Deaths in the past 3 months have far outpaced deaths from the rest of the pandemic before that. This is showing us that the Delta variant is indeed not only more contagious, but also deadlier than the original strain that we were seeing last year. So next, let's talk a little bit about boosters. Our vaccine clinic at Southgate Mall is now providing Pfizer boosters to certain residents. Residents must have been previously vaccinated with Pfizer, and there's no exceptions to that. And they must be at least 6 months out from their second dose. They must also meet the following qualifications: age 65 and older, and residents of long-term care facilities ages 18 and over. Age 18 to 64 with underlying medical conditions, age 18 to 64 who are at increased risk for COVID-19 exposure because of their occupational setting. This would include first responders, educational staff such as teachers, support staff, daycare workers, food and agriculture workers, manufacturing workers, people who work in corrections, postal service workers, public transit workers, and grocery store workers. You do need an appointment for booster shots. They're not available on a walk-up basis right now. This ensures that we have the staffing and resources available. However, first dose and second dose patients can still walk in for an appointment. We're making patients who have yet to get vaccinated at all a priority at this time. So next is an update on testing. The main health department office in downtown is seeing an influx of residents that are showing up in person asking for a COVID-19 test while they're symptomatic. We would like to remind everyone that we are not offering any tests at the health department's main offices. We also don't want symptomatic people potentially exposing our staff to COVID-19. Everyone who shows up at the main office for testing is going to be turned away. Instead, you need to call 258-INFO, which is 258-4636, to book an appointment for our testing facility out on Flynn Lane. We know that the wait times for our call line are long, but we appreciate everyone sticking with the process, and we hope to improve those wait times soon. We've just had so many people seeking testing that our call takers are taking a little bit longer to get to everyone. Okay, so here's what we know so far about COVID vaccine for 5 to 11-year-olds. It's expected that Pfizer vaccine will be approved in 5 to 11-year-olds in the coming weeks. Parents, we're strongly encouraging you to use legitimate information and talk to a pediatrician when it comes to making health decisions for your child. We're sadly already seeing a lot of misinformation online about vaccines for this age group, despite trials showing that they are perfectly safe. We strongly encourage parents to get their children vaccinated as soon as the CDC approves a vaccine for that age group. It is a common misconception that COVID-19 doesn't get children very sick, but that's actually not the case at all. Delta is different in kids than the previous strain of the virus. Children are getting sicker. Children are also impacted by long COVID and multi-system inflammatory syndrome, which is linked to COVID infections. So even if you think your child would be fine if they got COVID, you just never really know until they get it. And that's a gamble that just isn't worth taking. So last, we're heading into cold and flu season, and with COVID circulating, it's especially important to get a flu shot. This will help reduce the number of people who need COVID tests in the community. Plus, it's possible to have COVID and the flu at the same time, which we're sure that no one would want to experience. Our immunization clinic offers flu shots as well as healthcare providers and pharmacies around town. So definitely go out and get that flu shot. So that's it for my briefing today. As always, you can subscribe on YouTube under my name, Cindy Farr. That's CindyFarr. Click the notification bell so you know when additional videos are uploaded. You can check out our Facebook page under the Missoula City County Health Department. You can go to missoulainfo.com for all of the data and lots of other information, or if you need to book an appointment for that booster shot. And you can call 258-INFO if you need to get a test or if you have questions about COVID-19. As always, stay healthy.